Let's face it, there are some topics that we don't like thinking about, like gynecologic cancer. And if we don't like thinking about it, we really don't like talking about it. Because talking about things that happen down there can be embarrassing. And how do you bring up uncomfortable topics like your reproductive health anyway? Listen up, guys. We're talking to you too. Everyone has a mother, and these cancers affect wives, sisters, aunts, and daughters. We have to break down social barriers and really talk about the importance of women's health. That means using words like ovaries, uterus, cervix, and vagina. So let's rescue the vocabulary. Let's talk. Really talk. Because in the real world, we're dealing with statistics like this. Every 6 minutes, a woman is diagnosed with gynecologic cancer. And like most cancers, treatment for the 71,500 women diagnosed with gynecologic cancers each year is most effective when the cancer is caught early. And, like most cancers, signs and symptoms for any gynecologic cancer might not be related to cancer at all, but they might. And regardless, we should know. It's our health on the line. Common things like bloating, frequent urination, or more specific symptoms like feeling full quickly, pelvic pain, or changes in bowel habits are symptoms we need to talk about with each other and, more importantly, with our doctor. So this means, ladies, it's time to reclaim the discussion. It's time to reclaim our health. It's time to talk. So let's do it. Let's talk about gynecologic cancers. Let's talk about learning your risk factors, signs and symptoms, and about prevention. Let's talk about the fact that most cervical cancers and some vaginal and vulvar cancers can be linked to HPV. Let's talk about your body. What's normal, what's not, and what you should look for. Let's talk about your family history, what you know and what you need to know, and how to ask those questions that might be uncomfortable. It's up to us. Let's talk about risk. Let's talk about prevention. Let's talk about gynecologic cancers. Let's talk to each other, to our moms, to our spouses, sisters, aunts, grandmas, and friends. When something doesn't seem right and symptoms persist, talk to your doctor. Early detection and prevention saves lives. Don't become a statistic. Take control of your health and break the silence.